Hi, this is Plus One Baby channel, and today I am going to talk to you about pain relief in labour. So I'm a first time mum. I have never been in labour before. I have absolutely no idea what it's going to be like. I have seen all of the movies and all of the TV shows that make it out to be absolutely awful. So I'm kind of imagining that it's going to be quite bad, but I really have no idea of what's going to happen. So I went to antenatal classes, and one of the sessions was about pain relief in labour. So there are a number of different options around pain relief, and I think most people will have heard of the epidural. So the epidural is a needle that goes into your back that can give you pain relief, and it makes you quite numb. And initially I thought that when I got pregnant and I went to have a baby, I would be saying, give me the drugs, I need an epidural. But as I have done some more research, and as we discussed what the kind of pros and cons of this pain relief method are, I have decided that actually, as part of my birth plan, my aim is that I'm going to try not to have an epidural. And the reasons why I am now leaning towards not having it is because there can be negative impact, and that's the things that are negative about epidural, is that it can make your labour longer, because obviously it actually works numbing you, so it can cause you to find it harder to push. So it can elongate your labour. And the other thing it can do is, obviously it is a drug. So essentially, as you take the drug and the baby is inside of you, essentially, you're still connected by the placenta. So anything that you take into your body is then passed on to the baby as well. And that's the case with other drugs that you may take in labour. So I think the other drug that sometimes women take when they're in labour is called Pethidine, and that is sometimes given to mothers when they've had a really long labour and they're kind of super tired and they really need something. But in the antenatal class that I attended, they did talk about the fact that if you have drugs, then it potentially can make your labour longer. The other thing about taking drugs is, you may have heard that sometimes the doctor will say, you're too far gone, you can't have an epidural. Well, apparently, according to our midwife who ran the antenatal classes, that's not strictly true. If they do say that to you, they're only saying that because you're already, say, 8 or 9 centimetres dilated, and the more dilated you are, that's going to be the peak of the pain. So if the doctors check you and they see that you're dilated by around 8 or 9 centimetres, they're kind of suggesting to you that actually you're in about as much pain as you're going to get. So if you've gone this far, you might as well not take the epidural, because you don't actually need it. And from what I remember is that one of the other things that can happen with the epidural is that you can be more likely to tear. and need an episiotomy, which is where they have to snip you to get the baby out. And that's just because you're a lot more numb in that area. So the plan of action for me is to go a bit more natural. So aside from the drugs, which are epidural and the Pethidine, you can take the good old gas and air. So I actually broke my arm earlier this year, and when I went into hospital, gas and air was one of the things that they gave me. And in terms of pain relief, I thought it was wonderful. It was absolutely hilarious. So when you're on the gas and air, it makes you feel kind of super, super drunk. And apparently gas and air, it doesn't really work on the pain. It almost makes you not care that you're in pain. So the fact that I've used gas and air and I've got on with it before, and actually it makes you feel kind of euphoric and really happy. So I'm planning on definitely using gas and air, which I think a lot of pregnant women do. And my understanding is that what you do is you need to, because you breathe it in through a canister, you just need to practice your breathing and make sure that you're breathing in the gas and air at the right time to impact the contractions. So the reason why a lot of people like gas and air is because, unlike the drugs, I guess this is a pro and a con, is that as soon as you take a breath, that works on you kind of straight away. But the negative is that it does run out quite quickly. So if to keep it topped up, you have to regularly be sucking on the gas and the air canister. And then if you stop, then pretty quickly it will wear off. Whereas, of course, if you've taken a drug, yes, that will take a bit more time to kick in, but equally it's something that does last a while, and you can't get rid of it straight away. And then the other forms of pain relief that we discussed in our antenatal class were something called a TENS machine. So because I am now looking to avoid drugs as part of my labour, I'm wanting to go down the gas and air route. I thought that a TENS machine would be something that I should invest in. So you can hire them online, and mine arrived today. They normally arrive 3 weeks before your due date. So let's take a look inside so I can show you what it is. So a TENS machine is something that you use to kind of help relax the muscles. And what happens is that you place these kind of electrodes on your back, and it helps to relax you. So it looks like I have all of the information here. I decided to hire the TENS machine. That is one of the most popular ones on the market. There are a few others. They're not very expensive. I think mine cost about £30 to hire, and you get it for, I think it's up to 7 weeks, and then you send it back. They give you free postage to send it back. But the machine looks a bit like a remote control. So I understand from reading up all the different reviews is that there's a little boost button on the side. So when you kind of feel the contractions getting heavier, you can turn it up and down. There are a few different boost functions. I think one of the things that I read up about it is that with a TENS machine, you have to be careful about when you put it on. So you have to put it on in early labour to kind of establish this routine. But a lot of the reviews that I read online, a lot of people were raving about it, and they were saying that they would absolutely use it again. Some people do say it didn't really help them that much, but I think the general consensus was that if they didn't have it, then it could have been a lot worse. So I'm definitely pleased that I have one, and I will be practicing putting it on. I guess the only thing is that you do need your partner to kind of stick it on your back in the right area to make it work for you. So I will be including the information around the pain relief that I want to get within my birthing plan. The other thing that I want to mention is that it's important to know that I want to give birth in a birthing suite as opposed to the labour ward, and typically in birthing suites they do not offer epidural, and that's because epidural is administered by a doctor. So if you are planning on giving birth in a birthing suite, which is a little bit less clinical than a ward, they have the birthing balls, they have the water bath, they tend to have kind of calming decoration, etc., then you wouldn't have the chance to have an epidural. However, I am told that the birthing suites are normally very, very close to the labour ward. So should anything happen or should anything be a problem during the labour, it's very, very quick to move into the labour ward. And another thing to bear in mind when you're deciding around pain relief and where you want to have your labour is that you can move from the birthing suite into the labour ward should that be a requirement, but you cannot move from the labour ward into the birthing suite. You're kind of stuck on the labour ward. So the plan for me, for now anyway, is to go into the birthing suite and to have the TENS machine and to have the gas and air. And let's just hope that this labour is not too long and then I can deal with the pain. I guess the other thing that I'm looking to do is, I haven't done any hypnobirthing classes, but I do know quite a lot of people that have. And I understand that that's a lot about breathing and keeping calm. So I guess one of my other non-conventional forms of pain relief is just going to be around breathing and meditation and trying to keep calm. One thing that I haven't really considered that I do understand that can be a good pain reliever is the use of water. And if you're in the birthing suite, they do have a water birth pool. I've never imagined myself giving birth in the water bath or the birthing pool. I don't really see that happening for me, but I understand that some women like to be in the water bath during the first stages of labour, or just before they're kind of ready to push, because the water can be really calming and soothing. So then I was thinking, oh my gosh, what do you wear in the water bath? Do you do it naked or do you wear a bikini? So in my hospital bag, I have put in a tankini just in case, if I want to get in, just to have the water to calm me and to help with the kind of pain relief, because it's supposed to be very calming for you. And that could be a good way, especially if I don't have any drugs and I need it. So we'll see what happens on the big day, and of course I will do a follow-up video to let you know if everything went to plan.